Hello, everyone. My name is Ryan, and I'm the Chief of Legislative and Regulatory Affairs here at the National Volunteer Fire Council. And today we're doing this roundtable discussion as a follow-up on our series of webinars and roundtable discussions relating to OSHA's proposed emergency response standard that is currently open for public comment. If you all haven't done so already, we strongly encourage you to visit the NVFC's landing page on this notice on the proposed emergency response standard for guides as to how it may affect your department and also ways in which you can weigh in. The public comment runs through now through June 21st, and possibly, from what I understand, OSHA is evaluating an additional 30-day extension at this point. So keep your eyes peeled for additional notifications from the NVFC on that point. To give you additional context as to what this emergency response standard is, if this is your first time being acquainted with it, OSHA is been in the process now for some years in updating their fire brigade standard, which has been in place for over 40 years, and expanding it into this new proposed emergency response standard. Of course, we at the NVFC believe that there are a number of things within this proposed standard that will indeed improve firefighter safety, and we applaud OSHA's efforts to do so. However, there are a number of requirements within this proposed standard that will be very difficult, if not completely economically infeasible for small departments to comply with. And this extends to small communities and cities. Some of these requirements include over 20 NFPA standards, either being incorporated in whole or partly, and also other requirements such as pre-incident evaluations, post-incident evaluations, risk evaluations, training and fitness requirements, and also labeling of scenes and all different types of things of this nature, which again, we're not opposed to, but again, require a great deal of staffing and economic resources to fulfill. So we are concerned about this. Again, I'll encourage you all to visit our landing page to learn more about the specifics of this, where you can see webinars that we've done previously on this topic, as well as guides on how to submit public comments to explain to OSHA what your department is like, and tell them about your ability to comply with this proposed standard. So with that, in line with the larger impact to municipalities and cities and counties, we have two presenters with us today, where we will hear from them about how their respective organizations share the concerns that we at the National Volunteer Fire Council have about how this will impact specifically all volunteer communities, but also small ones as well. So we have Ujjwal Ors, who's a legislative director for public safety at the National League of Cities, joining us, as well as Brett Matson, who is legislative director of justice and public safety at the National Association of Counties. So we'll hear about some of the commonalities we all have, and we'll hear about how they need you to reach out to your municipal and county officials to raise this flag and explain that this is going to affect them as well, and how you all can partner with your county and municipal officials. And with that, I'll turn it over first to Ujjwal, and then we can hear from Brett, if that works for you all.
Thank you, Ryan, and really want to thank the Volunteer Fire Council for allowing us the opportunity to come and talk to an issue that truly is going to be very significant for cities, towns, and villages of all sizes, but if not, especially for cities, towns, and villages that are smaller and more suburban and more rural. What I would really emphasize is our local elected officials really appreciate everything that the Volunteer Fire Services does for their communities, keeping their residents safe in times of emergency, and really are reliant on the Volunteer Fire Services to do so much in their communities. So again, really want to thank everyone that's on this call, but all volunteers, enormous amount of gratitude from our local officials. Um, as we are learning more and more about the OSHA emergency response rulemaking and how it not only is the volunteer fire services, but expands considerably the scope of who is going to be part of these new standards. It does we do recognize the importance of the making sure our firefighters and emergency responders are safe. They are well taken care of, and these standards go a long way to that. But implementation of these standards and the ability to afford them, what I would recognize is that many localities are just not aware that these are coming down the pike. So through the budgeting process, if volunteer fire services are receiving uh, municipal assistance in funding their programs, uh, these budgets do not have all these standards in them already, and it will take multiple years to get the budgets adjusted to be able to provide the appropriate level of funding that we are estimating these standards will be required. Um, and there are additional concerns that we have with regards to the implementation of standards, concerns around legal issues, compliance issues, and concerns around insurance for firefighters. We are also recognize that while the NFPA standards are, again, I would say the Cadillac of standards, they are very expensive to adhere, basically bring in. You do need to know, have people on hand that are administrative, that fully understand how those standards need to be applied, how to comply with those standards. Many communities do not have that administrative personnel in place. So you just to be able to comply with the new OSHA standards, you will need to be able to hire more operational and administrative staff to be able to comply with these standards. And then some of the issues that we are also facing is the fact that, again, I will emphasize many local officials just do not know about these standards. They need to really hear from their fire chiefs, their volunteer fire services. They need to learn more. And I think one of the challenges is if this is going to impact local budgets, it means that you're going to have to fund this, and it needs to be offset by reducing funding for other programs in a city. So priorities need to be established. So those are very difficult hurdles to overcome in local government budgeting process. So um, I know there's a lot more issues I can cover, but I did want to stop there but happy to get more in depth into the conversation and our concerns.
Now, I'm sure we can certainly cover that during the Q&A portion, and as we kind of speak more throughout the next few 15 minutes or so. There we go. But and Brett, yeah, certainly welcome NACO's perspective.
Yeah, awesome. Thank you, Ryan. And good afternoon, everyone. Brett Mattson, Legislative Director for Justice and Public Safety here at the National Association of Counties. So NACO represents all 3,069 county governments across the country here in Washington, D.C. In particular, our kind of biggest piece of the membership is our county elected folks, so commissioners, supervisors, county executives, things like that. But we technically represent the whole swath of any county official or any county staff member. So that's all the other elected row officers, but down to everyday just administrative staff or folks that that we represent here in DC. I'll try not to reiterate too much of what Ujjwal said, but largely what I was going to talk about is stuff that he touched on, but I'll kind of pivot and add just a little bit of the county lens to it. Just want to also, though, echo his thanks to all of the great work that you all do in your daily lives. Obviously, counties and cities alike couldn't be as well prepared and able to respond to events without you all. So we just want to say thanks right off the bat. A couple of things on the rule in particular. We at NACO are also in agreement that these standards are reliable and something that we, in terms of the intent behind the rule, are very much so for, but the feasibility and the cost behind implementing them right now is just not tangible and doable for our members. So that's kind of the blanket slate of where we want to start. I think one of the pieces that Ujjwal and I have talked about on other calls is really that this represents an unfunded mandate to a lot of counties and cities across the country. We know that there's talks of it being or not being an unfunded mandate, but when you really boil it down to the nuts and bolts of it, it's going to cost counties, cities, volunteer fire departments money to implement these standards and to also continue to meet those requirements year over year. So it really is an unfunded mandate, and something that generally unfunded mandates are something that we push back against in our roles here in DC. So that's certainly kind of just the high level of where we come at this rule in particular. Again, agree that there's necessary changes and reforms to these standards that are needed, but we certainly don't think that doing it at the cost of the county, the city, or the volunteer department is going to behoove those respective organizations. So a couple of other pieces, Ujjwal brought up the insurance piece. That's a huge issue that we're frankly still trying to grapple what the actual impact would be. So we're the National Association of Counties, but each state has their own respective state association of counties. And a handful of those counties, or a handful of those state associations, actually operate insurance pools for counties and county employees. So trying to figure out what the impact on those respective areas and jurisdiction is going to be as a result of this is something that, like I said, we're still figuring out, but is certainly of quite the concern, just kind of given the general insurance landscape right now. And what this potential rule would do in terms of increasing premiums or folks pulling out of markets entirely. That's certainly of a big concern for us, as we want that insurance to be there if something catastrophic were to happen. But it's likely that a lot of these insurers would pull out of markets if this rule were to go into effect and leave counties, cities, and a whole host of other employers kind of grasping at straws as to how they're going to cover the necessary folks. The budget piece to this is also quite the concern. Ujjwal pointed this out very well, that if this is to go into effect and there is a cost, and we are very much so under the assumption that there is going to be a cost associated with this, how are counties and cities going to deal with it? They're going to have to either cut other services or they're going to have to raise taxes. And the latter, especially during an election year, or which basically every year is an election year, is not feasible. So increasing property taxes, implementing a sales tax, even at 0.01%, is going to have quite the political blowback on both of our memberships. And so that is also not feasible to try to pay for this. So they would have to look to cut other services or other positions, which who knows what those would be. But it would largely vary county to county, city to city, township to township. But as you can imagine, cutting any services that already exist is going to leave someone out in the cold, whether it's that individual that you're cutting their respective job, or whatever issue it is that they're working on or covering, that might not be accessible to the local residents, which could also cause pushback. So there's a lot of sort of political angles to this rule as well, that we, representing elected officials predominantly, are very concerned with, just what those ramifications might be going forward. I think just kind of the last couple of things that I'll touch on is, while we are certainly concerned and think that the largest swath of our membership that will be affected are kind of small rural jurisdictions, some suburban areas, this is going to impact just about every single corner of the country. Obviously, rural and small jurisdictions are going to probably feel it the hardest, but even some large urban areas, some larger suburban areas, like there's going to be costs associated with this. There's going to be potentially individuals let go because they can't meet those requirements, or that the jurisdiction can't afford those costs for the whole swath of individuals in their fire department. So there's a lot of effects that are going to be felt regardless of the size of the jurisdiction. Obviously, those small areas are probably going to be the ones that either have to shut down entirely, or figure out a way to do it with a neighboring jurisdiction. But we really are under this assumption that all of these jurisdictions are going to have some tangible impact as a result of this, and frankly, most of those, if not all of those, are going to be a negative impact. The last thing that I'll mention is NACO and NLC did file a letter for extending that deadline, that comment deadline, past the upcoming June 21st deadline, as we really don't, again, think it's feasible to require our folks to be able to parse through a over 600-page document and figure out what the impacts are going to be, let alone for Ujul and myself and Ryan. Coming through 600 pages is a tall order in and of itself. So as you can imagine, in some of these corners of the country, it's just not even realistic given the part-time commissioner that is working in rural Nebraska. So it's really that upcoming deadline is quite the issue. And so I'll stop there, turn it back to Ryan. I know we have some questions, but just want to again say thank you so much for the invite and for the work that you all do on a daily basis. We greatly appreciate it.
No, thank you, Brett. And yeah, no. So one question that just came up in the Q&A. So context is certainly important as to, did this come up overnight, and what's the development process? OSHA has been working on this proposed standard since 2007. There was a request for information, and then subsequently there was a NACOSH and what's called a NACOSH committee, and then a SBREFA committee, because this, of course, is a issue, as we are all assembled here, that represent small entities. SBREFA panel is designed to represent the interests of small entities, and the National Volunteer Fire Council did have representation on both of these committees. I believe the NACOSH was assembled in 2014, and the SBREFA panel was assembled in 2021. So there has been a lead up to all this and to where we are today. And then, of course, this notice of proposed rulemaking was published and was announced in December and published in the Federal Register on February 5th. So good question about context and how this came up and where we are today. Just kind of, now that we're aware of that background, where we are, what's going on, I mean, I do know, when we read through the SBREFA report, there were a number of concerns that were raised. And of course, this is all relevant to us here as small entities. But, and also there is a portion of the notice of proposed rulemaking that is towards the end in a chart that I do think is valuable to take a look at, where OSHA does respond to some of the concerns and how they tried to address what was raised in the SBREFA panel. And fact of the matter is, they did try to address it. However, I do strongly believe, and I think my colleagues here on this, on today's roundtable, do agree that it wasn't enough, that there's still a degree of economic hardship that's going to be encountered here. I mean, we just conducted a survey of over 1,100 departments, and 7% came back saying that their budget's under $25,000. How is that gonna impact? And with as we just heard from our respective panelists here, if and I'm sure those of you who are fire chiefs on this call are leaders in your department, it's going to be very, very difficult for you to approach your local elected officials, understandably so, to say, hey, I need you to fill in this, to have this backfill. And then, of course, there are, Brett and Ujul's members are going to respond back being like, well, we cannot raise taxes that much. We don't have, we can't play with the budget that much. So this is definitely an important conversation to have, and just kind of, and in that line, addressing another question that came up in the Q&A, both Brett and Ujul. what are some best practices in which volunteer firefighters or leaders within their local fire service can go to their elected official to what are some things to highlight to them in this initial conversation to raise this as a concern? And is there are you aware of any of your members maybe having budgetary information that could assist our members in collaborating to get well-informed comments to give OSHA this picture they need? So I guess that's kind of a two-part question. How do you approach your elected official? How do you raise this as an issue? And then what are maybe some budgetary information they should be asking for?
Great question, and what I would definitely say again, it's with regards to cities and the city councils and the town councils and everything else play a considerable role in the budgeting process, the mayors. So, and they're working, a lot of them are required to have a balanced budget. So everything has to be accounted for. Also recognizing that many municipalities are limited to what type of taxes they can utilize in their budgeting process. A lot of it is related to property taxes. But while some municipalities have sales taxes, that's not always available to a lot of, especially smaller cities, towns, and villages. Recognizing that it is imperative as soon as possible, when the volunteer fire chief is able to talk with their mayors and council members and at least advise them that this is coming down the pike, that there will be financial implications, and I try to work with them to identify what is actually needed. Will there be a need for administrative staff? Will there be a need for legal advice, meaning legal costs? What are the potential insurance implications? A lot of municipalities work with their state leagues, and our state leagues provide risk pools and insurance, government insurance for firefighters and everything else. So they need to talk and find out what are the implications to insurance. What are the implications of potential, as I said, liability? Um, we know that I'm going to go off topic on one side of that conversation. We know that OSHA regulations in states that are OSHA approved versus OSHA not non-OSHA related states, there's a question of who is covered by these new standards.
And actually, I'll just interrupt you one sec, Joel. And I know I'm only saying this because in my conversation with our members, there's been just kind of like, so what does this look like? This Fed OSHA state, and then these states with state plans. And again, I'll say, like, for our folks, we can send around a link. I know I keep on referencing the NVFC's landing page. We will send that link and a follow up to this, but there are these states that are approximately 20 states, 20 plus states that have these state plans that they'll be required to adopt. That these states are required to adopt either this OSHA standard. If adopted as is, they would be required that would be the floor in which they would regulate the entities within their state. And then there are the Fed OSHA states that do not have these state plans that kind of just fall under federal OSHA. So that's just kind of just a little bit of a clarification. So but anyway, sorry, Joel, just want to jump in before we kind of go down that road. Yeah.
Sure, and again, that's one of the biggest questions we have is who's going to be covered. And in those states that are not OSHA, that follow OSHA, and the local governments are excluded. Local governments are excluded from OSHA standards. But I would tell you, even
that's in Fed OSHA states, right?
Right.
Yep.
The federal OSHA states, local governments are excluded from that. But I will tell you, talk to an attorney. If these are adopted standards in federal government, that's a liability, and most of your attorneys in those municipalities are going to say, regardless, you need to follow these standards. So there's a liability concern because once it's federally adopted, it becomes an even higher standard to uh, adhere to. So we are notifying our in both jurisdictions that these OSHA rules will most likely apply, regardless if you have to comply or not. There's still a lot of unknown answers, but start talking to your mayors and council members, not just the mayors, but council members, educating about them, really emphasizing what are the questions that need to be answered, and work with them. They might be able to give you a little bit more on the financial side, what the budgeting considerations are, and what are the limitations of complying with these standards.
Yeah, and Ryan, I'll just kind of piggyback off of what you just said there. Not too much to add, but I think that it's important to say two things. One, reach out to them as soon as you possibly can, and if you for some reason don't know who your county official is, or who your city council member is, or your mayor is, please reach out to Ugel or I. I'm sure Ryan can pass along our contact information, and we can get you contact information for any person at the city or county that you might need. But reach out to them as soon as possible. We have tried to do as much education as we can, but with 3,069 counties, each of them doing something different, trying to reach out to all of them and make sure that they all know about it is not exactly the easiest or most feasible task. So would certainly encourage you just to reach out to them, figure out what they do know, what they don't know, have them reach out to us, whatever the kind of next step is there. We're happy to chat with any individual cities or counties. Secondly, and again, to Ugel's point, is to figure out what the budget situation is. So, even if this rule does go into effect, it's not going to go into effect tomorrow. So figure out what the year, 2 years down the road forecast is going to look like, and how you can start to mold those conversations when the time comes. So a lot of counties have already gone through their budget cycle. So this is going to be a next year conversation anyways. But figuring out and getting ahead of it as best as you can, what those funding shortfalls might be, or what those staffing shortfalls might be, to see if there's something that the county or the city could pull from to help to cover those if this is to go into effect as it currently sits. Those would be my 2 points there. Right, I think you're muted.
Yeah,
There
there
you
we
go.
go. No, appreciate that both, Yujel and Brett. And just kind of long story short, so some clarifications here. So really, this insurance liability question affects all 50 states. Is that correct to basically assume potentially one way or another?
One way or another, depending on when it goes into effect, but yes, eventually it'll affect all 50. As Brett said, it'll affect every corner of this country.
Um, No, and that's some good input. And also, just looking at the Q&A chat. So, some folks are curious about what standard, what things within this notice of proposed rulemaking would be what at the NVFC have identified as most burdensome. And we did a presentation last week that is available. There should be linked either to our landing page or to our virtual classroom, where Dave Dennison, who is a partner of ours through this process, really did a fantastic job of outlining some of the most burdensome aspects of this notice of proposed rulemaking, in the notice of proposed rulemaking relating to this proposed standard. And I see that a link to that was just added to the chat. So anyone who's interested in some of those really specifics there can delve deeper there. But just some highlights, some things that have been raised to me is the availability of expertise. How there's requirements for fire officer 1, 2, or 3, depending on where you plan to, what position you hold in a department. There's this notion where according to if the proposed standards implemented as is, how an FDNY chief could not just kind of lead up a volunteer department department on Long Island or municipal New York because they didn't receive fire officer 3 training, and also kind of having conversations with other fire service organizations. There are certain states where this training isn't even available. This expertise isn't even available. And that's kind of, I think, availability of staffing and expertise is kind of a good segue into kind of a question for our panelists here, where you talk about hiring this administrative staff to implement some of these standards. And the NPRM kind of goes into a little bit of how much that may cost. Where we're looking at potentially I think $20+ an hour. So do you, how available do you think this expertise would be for some of your more rural constituents that you all represent? And do you think that that will pose an obstacle? Is that something to kind of for our folks to raise in their conversations with their municipal officials?
I will tell you, based on what we have always heard, especially from our small cities and towns, staffing is one of the biggest challenges that they have. Having people with the expertise. When we worked to get ARPA funding down to every municipality, every town, and every village, the biggest challenge they had was identifying somebody that was going to be able to manage that funding and how to make sure it's properly accounted. That's not even to the level of what these standards are going to be requiring, the compliance requirements and everything else. So identifying somebody with the expertise and the training, we just don't see it available right now to the level that it will take potentially years. And what I would say also is this should never be a one size fits all situation. There's many differences between how municipalities are managed, how they are governed, and how those volunteer fire services fit in those governance. It could be a nonprofit, it could be completely separate. So a one size fits all standard is very problematic because it's just not going to be able to be achievable. And that's another concern we have is what if these municipalities, these volunteer fire departments are not able to comply with these? What happens at that point? Do they have to close down? Do you have to merge fire departments? Do you have to create a more professional fire department and forego volunteer fire services? These are the things that are going to raise higher.
Also, I'll stop here. We use the career word. We use the word career here. We're all professionals, so I'll stop
Absolutely,
here.
I
Yep.
apologize. Career services. So those are, I mean, again, what happens if you're not in compliance with these standards and you don't have anybody to be able to properly document if you are in compliance or not? So the administrative costs are going to be enormous, and localities just don't have that level of administrative staff to be able to provide what is needed to comply with these standards.
And the only thing I'll add to that, yeah, absolutely agree and echo everything you just said. I think the other sort of added layer to this is it's not just a one-time thing. Like this individual or with the expertise is going to have to be around for years and years and years. And what we'll often find is, especially in rural areas, if there's a suburban or large urban county that's, a couple of miles away, they can pay a lot more. And that individual will likely go and work for another county after a year or two once they've gotten that expertise. And so then that rural county is potentially left with no one. And the person that they did have who was great has now left. So then what do they do? Like, do they have to bring in someone completely new? So I think that's kind of another piece of this is it's not just a one-time thing. It's going to be year over year over year. And how do you manage that? How do you budget for that? Especially like smaller jurisdictions where money's already tight, and this is just going to be another added layer to that. And trying to get staff who are competent and reliable to do this type of work in those smaller jurisdictions is already a challenge across the board. And so, these kind of nuanced conversations are going to be tough to get someone there that can do the job consistently and year after year after year, and willing to stay in that area. So I think that's another challenge that we see across the board, but particularly in this case, it's going to kind of rear its ugly head pretty early on.
Absolutely. And kind of in line with that, early on, we're getting some questions in the chat about implementation time frame. If this is adopted, what does that look like? All that kind of related stuff, for lack of a better word. So my understanding is in my conversations with OSHA, say this is, say we have, this 1 month extension that's currently being considered, is published and goes through, is finalized. That brings us through July 22nd. Then then it's my understanding in my conversations with OSHA, we'll have a few months where OSHA will review the comments, and they do understand that there is a strong interest in having a public hearing and a need for a public hearing due to the magnitude of this proposed standard. Now, after that would happen, there will be an additional public comment period. And from what I understand, the hearing would take place late this year, early next year. And then, of course, additional public comment period afterwards. So probably looking at, minimum mid early next year adoption if this proceeds. Then within the NPRM, you can find and we can flag this for you all in the follow-up communication. There is a proposed timeline. Looking at this proposed timeline, I can see that you all on the call as representative of volunteer departments will find this timeline problematic. It varies for certain paragraphs of the proposed rule or standard, and but it is a fairly tight turnaround. And so that's something that I know in our comments with the National Volunteer Fire Council, we would be expressing your need of needing additional time to find this staffing expertise, to locate the economic resources, whatever you would need to best comply. Because we know for a lot of you, it's even going to be impossible if this is adopted as written. But for that timeline to best comply, it would need to be extended. But looking at, for certain sections of the proposed rule, if I remember correctly reading it, but again, we can flag this for you all. We're looking anywhere from, from, I believe, 12 weeks was the shortest period of implementation to a couple of years being the longest period. So that's kind of what we're looking at. So it's not necessarily going to happen overnight. It's not going to be a flick of a switch, but at the same time, given the magnitude in a relative sense, it will be a flick of a switch. So, and that's something that I think, I know you, Joel, and Brett also share with with the entities that with the counties and municipalities that they represent, that this is going to present a very large challenge. Approach kind of in line with what we were saying about availability of staff power and expertise. And another question has come up for you both is with how we talked about insurance, what do you see happening within the liability landscape in relation to this as well?
Again, those are things that we are in the process of evaluating, working through NLC risk and NLC mutual with regards to insurance and liability. We still don't have a clear understanding of the full implications of this. So that's going to take a while to determine what are potential cost increases, what are the insurance costs and everything else. Especially when there are issues related to physical examinations, mental health examinations, and the like. These are added costs and require additional resources. So unfortunately, I don't have approximate, but it is something that our insurance pools have raised as a concern.
Yeah, I agree with you, Joel. It's something we're trying to get a full sense of the liability concern. I think just on its face, there's absolutely a liability concern for any cities or counties if departments do not meet these standards, and what the potential impact for those jurisdictions are, and will they have to take out additional insurance, things like that. But we're still trying to piecemeal together what those impacts, probably on a state by state, county by county basis, are going to be based off of what they have existing already. So there's unfortunately a lot of nuance to that particular issue, but I think, again, like as it sits, there's absolutely a concern. I think it's just to what is the depth and breadth of that concern, and what are the true impacts is something that we're still trying to figure out.
Understood. So I know we covered a good deal of ground here. Is there anything else that you all see as a concern that maybe we haven't addressed through the course of our conversations that you all have kind of have seen that maybe we need to address within the scope of our audience today, and just kind of give them a heads up on?
I mean, no, I think there's a lot of issues that were covered. I think, again, our biggest concern right now is the lack of knowledge about these. And I appreciate, we appreciate how long OSHA has been doing this and putting this together. But understanding that there was a lot of input into this development of these standards. However, we are concerned the level of input that came from local governments. We would have, if we had known earlier or had been more involved, we would have raised a lot of the concerns, and hopefully we could have addressed a lot of the issues prior to the rulemaking. We just just want to reemphasize the need for additional time. This is a very complex issue. The rulemaking has a lot in there. Our members are, there's a lot to reference and a lot to try to do research and find the actual numbers. And we just don't have enough time right now to be able to provide the best information to OSHA on how this is going to impact our cities, towns, and villages across the country. We just don't have that capability. It's going to take a long time to develop that. And unfortunately, we can't just, snap our fingers and be able to
Yes.
provide them that information, unfortunately.
Yeah.
Yeah, I again, you just kind of stealing my thunder on a lot of these, which is totally fine, because it's what we do at cities and counties together. So yeah, I completely agree with everything Yudel just said. I did see in the chat a question about the letter from Congress voicing concerns. I think that's another layer to this onion, that if you haven't reached out to your respective members of Congress and notified them about this, and let them know about the concerns specifically for your jurisdiction, would encourage you to do so as soon as possible. Those are, for better or for worse, what a lot of or carry a lot of weight with OSHA and other federal agencies. So if there's ways that you can get in touch with your member of Congress and let them know that this is coming down the pike and that it's of grave concern to your respective jurisdiction, I think that's another great kind of iron in the fire outside of what we've talked about here today, in terms of getting in touch with your city and your county officials. So would leverage that, but would also just say leverage any and all associations or groups that you're a part of. Raise this as much as you can, and on calls with your counterparts, with states, with cities, counties, whatever it is. Every voice is a force multiplier here, and we at NACO and NLC are certainly not able to touch and cover every single corner of the country. We wish we could, but however you all can amplify this as being of concern and get more voices to the table and more people reaching out to OSHA and letting them know that this is going to be a problem, the more likely they are to hopefully kick the can at a minimum, if not revisit entirely what this proposed rule looks like. So the more that they hear, the old squeaky wheel gets the grease. We're all trying to be squeaky wheels up here. So however you can get that message out, I think is going to be super helpful at the end of the day.
No, thank you, Brett. Appreciate that. And yeah, so I think we covered a lot of good topics. Just kind of identifying that your local officials within the municipal and county level are sharing your concerns, flag this for them, especially from that budgetary angle, and and also just the potential insurance liability as well. It's a conversation to raise, have. And so pretty much, what do we do from here? What do you all do from here? So have that conversation. Brett and Brett Usual were kind enough to, put themselves out as resources for you to identify those officials within your local area where you can raise this and be that agent of spreading awareness. And also, again, see if they do have some resources. Cases do vary, but maybe they have some resources for you to figure out and help you assist with some of your budgetary data. So again, what are some big things coming up here? So we have June 21st. We have the June 21st comment deadline. Again, we're looking at potentially a 30-day extension. OSHA will likely confirm this and publish it within the Federal Register within the next week or two. So that is the big item on our to-do list right now collectively. OSHA needs to get a better idea and a better picture of municipalities, counties, and volunteer fire departments across the country, and their economic ability to handle this proposed standard economically. The way that is done is through you all submitting public comments. There's 229 of you, currently participating in this webinar and viewing it. And if each one of you submits an informed public comment where you tell that story about, hey, I get my funding from, either, pancake breakfast, or I get my funding from my municipality, but their budget is XYZ and it's really tight. Or, I have this many staff at my disposal. I don't have administrative staff. What your community's like, what your response is like. Just tell that story, paint that picture to OSHA. And again, I would refer to, the NVFC's landing page and the webinar last week that was linked in the chat. That kind of goes over some of the more painful and specifically burdensome aspects of this proposed standard, and use that as a starting point. And we also have a comment guide that can help you out as well. And we're here to answer questions. I will be holding office hours to just kind of answer questions and describe best practices weekly, until the deadline, until the public comment deadline. So please take advantage of that. Take advantage of some of this guidance that we have available. So, but I would say that is the big thing to focus on, is just telling that story ahead of this public comment period. And as our panelists have said today, raise this to your local government officials as well, and partner with them on this. And then, of course, just again, re-emphasizing timeline. We will have other bites at the apple. There will be this public comment. There'll be the hearing on this, public hearing, additional public comment period following the hearing. So be aware of that. We will keep you all abreast of this. I know there's been some questions as to when this will be voted on. This is a federal rulemaking. There really isn't a vote. There's a series of comment periods. The OSHA, the federal agency, will evaluate these comments, evaluate what is said at the public hearing, and possibly retool this proposed rule, and then they will issue their final rule eventually down the process. So this is kind of just how this federal rulemaking works. There's not necessarily a vote per se at any point, but there is this process of a proposal which they've put forth. This isn't written in stone. This is an opportunity for you to say, this is what you got right, and this is what you didn't get right. And then they take that into consideration, and then they'll put forth another version or potentially a final version of this proposed rules or standard that you would have to adhere to. So that's what we're looking at here. Again, your homework is to can't say it enough. I know I sound like a broken record, but talk to your folks, talk to your congressman, talk to your local officials, and submit those public comments. And again, just tell that story. Don't worry too much. Just make it as descriptive as you can. And the goal is to just make sure that OSHA has much information as possible at their disposal. I don't know if any of our panelists have any final thoughts, but that's just kind of mine. And but I do thank Ujal and Brett very much for their time today, and also and for their partnership on this very important issue.
Ryan, I would just emphasize, while everybody on this webinar is encouraged to submit comments, work with your city officials and also have them submit comments with you or separately. As the city, as the town, as the village, as the county, let them also, it's not just coming from we want to make sure it's not just fire services is coming from, but it's coming from a whole host of key parties to this rulemaking, and get them engaged and make sure that they're filing their comments. We're going to work hard to make sure our mayors and council members are filing comments, but they might need a push from all of you to make sure they do it as well.
Yeah, I would just echo that again from what you just said. If there's ways that we can be helpful in reaching out to any of your county or city officials, like I said, I'm sure Ryan can share our contact information, and we're happy to assist in that process however we can. Just want to say thank you again for all the work that you all do on a daily basis, and just appreciate the invite today. And we'll keep marching forward, and hopefully we can make some tangible changes to this rule, as we pretty well know that it's going to have some very detrimental impacts to most, if not all, of the folks on this call, but also the constituents that Ujal and I represent as well. So just want to say thank you again.
Thank you, everybody, and that's conclusion of today's webinar. And we thank you all for participating. And again, get going and tell OSHA that story and submit those comments. So thank you, everyone.